According to the 2010 census, Nevada has the third highest rate of uninsured persons in the country at 21.3%. The correlation between poverty and poor health is well established, and it is still true today that poverty is deeply linked to how long a person lives and how healthy a person is. Community Health Alliance is an organization working to improve the health of the uninsured, underinsured, and the working poor of northern Nevada.
This started as the brainchild of the Washoe County Medical Society in an attempt to provide primary health care for the uninsured, the underinsured in Washoe County. This started back in 1995 when we had a small clinic at Harvard and Vassar. And if we could fast forward to, say, June of this past year, we have grown from that little clinic to the big one here at Wells, the Hawk Medical and Dental Center, to our outreach homeless clinic on 4th and Record Street. And we're the only medical facility in Virginia City. And that's where we were in June of 12, seeing about 66,000 patients a year in visits and about 26,000 registered patients. About that time, we began talking about the merger with St. Mary's, and I'll let Mike introduce that part of it.
St. Mary's, with the start from the Dominican Sisters of San Rafael, had initiated a lot of community-based services for the underserved. When St. Mary's sold in July of 2012, the new purchase, the owner did not want to take those programs on, but there was an outcry and insistence that those programs continue. So we developed this merger with Hawk and formed Community Health Alliance. It would incorporate both the St. Mary's mission outreach programs, which were primary care clinics and mobile programs on trucks, as well as with the Hawk clinics. So we've become Community Health Alliance.
What a great merger.
So
Yeah.
now we're now 5 community health centers, 4 mobile vans, 44,000 registered patients, and we anticipate over 100,000 visits in this July through 12 and July of 13.
So in 1 year, that many visits in 1 year?
That's correct. Among all of those facilities, the dental, the medical, from Sun Valley and Neal Road to Wells to 4th and Record Street to Virginia City, and the dental mobile and medical mobile vans.
Okay, so let's talk a little bit about what types of things people can get service for at Community Health Alliance.
Our mission is to provide health care, especially primary health care and dental care, to underserved people. And so those are folks who don't have any insurance or who have Medicaid or are underinsured or just can't get in to see a physician, and maybe they're insured. So we design the program so that we're really working hard to reach out to get people into primary care because there's such a shortage of care services available. So people can come to our facilities, get good, basic, high-quality primary care. While they're in their visits, we have x-ray capabilities, we have laboratory services, we have a pharmacy on site, we have dental care, we have social workers, we have behavioral health care, all integrated into a package so that we can wrap that around the patient and their needs.
How much time do you think? If I got sick today, could I see a doctor today?
Yes, you could come here, enroll. You would have to get in to see the enrollment person so that you get entered into our system. And then if you were sick and showed up without an appointment, you would have to wait until the next appointment is available, which it could be in 15 minutes or it could be in 2 hours. Because the way it works
But
is...
it's not going to be 2 months.
It's not going to be 2 months. You could get it immediately. But if you're a regular patient who you can call and get an appointment scheduled in the next several weeks for an appointment if you're not urgent and can wait.
So once I'm enrolled,
Correct.
I could just decide I need my mammogram or whatever it is I need, and I
Have a
call up and
scheduled
make an appointment.
Exactly.
Like a regular doctor.
Exactly. The
That's,
same.
we provide access to primary care similar to the access to the primary care providers in the area. We just do it for a different population of patients, those who ordinarily would not have that access due to lack of insurance or underinsurance.
The scope of medical conditions covered is extensive and impressive.
People are going to show up for just your everyday colds and flu. You're going to have respiratory infections. We're going to have kids who need immunizations. They're going to have developmental issues. There's going to be people that have skin lesions. There's going to be dermatology. There's going to be women who need to get women's health services for breast exams and cervical exams that take place. We're doing a lot of health screenings with prostate. We're doing screens with colorectal cancer to look at the preventative aspects of these.
We have a pediatric wing, a separate pediatric wing in our facility that is catering just to children.
My main role here is to monitor all women's health. which includes mammograms and pap smear services. I make sure our patients qualify for the programs we have here. We have the Women's Health Connection and the Susan G. Komen Grant Foundation also as well that we offer here for our patients to receive free mammograms and pap smear services.
I can't imagine having to make tough decisions like, should I take my child to the doctor this week or buy food? Community Health Alliance is servicing people well below the poverty level, providing quality of life and extending lives. The importance of these services is apparent, and like any community organization, it takes community involvement. How can the community help your organization? How do you stay funded? What do we need to do to make sure that your services continue? Because obviously, with the numbers that you mentioned, this is a pretty important place.
Right.
We have a pretty healthy budget. The federal grant is only about 15% of that total budget.
Only 15%?
Only basically 15%. The rest, there's a big chunk of it comes from what the providers do, the revenue that they generate. But then, as in the Tennessee William, we do depend upon the kindness of others. We do have a Community Health Alliance Foundation whose only job is to raise money to support all the various programs that we put on here.
So you operate as a nonprofit organization?
We are a nonprofit.
We are a nonprofit.
We have many grants that we receive from generous grant givers. We have private donors. So it takes really the combination of all of those things to really make it work.
We have very generous foundations in this area who have been continuous supporters of what we do.
Isn't Northern Nevada awesome that way?
It is.
It is absolutely awesome.
It is a
that way.
wonderful community.